So, welcome back again. How is it going till now? Until shoulder, scapula, all clear, all shorted, all practiced? Wonderful. So now we're going to see spine. In the spine, the first structure we are going to see the cervical area. Okay. So cervical area, we call it to the neck area. All right. So all the vertebrae, we call them vertebrae, which are in the neck area, they are 7 in numbers. All right. Comparatively very smaller, weaker. In what sense? If you will relate with lumbar, okay? So they are shorter, they are weaker. So this cervical area, which you are seeing right here with me, are having very tiny ones here. And then the cushioning is also not too much, if you will see, tiny cushioning, okay? And then in this smaller area, you can also see these nerve endings coming out. Can you see this? These are the spinal nerves coming out. And in the center, we know that what is going here from the in between the vertebra, it is the spinal cord. And from the spinal cord, all these associated nerves, the spinal nerves are coming out. And they are responsible to take the charge of the upper body, mid body, legs, and everything. Okay. And so that's why we call spine, the Merudand, as what? The life of the body. If it gets affected, gone, you're gone, isn't it? So definitely we need to keep it fit and healthy at the same time. So we need to understand one thing in relation to injury prevention when it is you're doing yoga or you're doing any other activities. What is so important to protect the neck? Because the neck is very sensitive area. The cervical area is not that strong because you're not loading it, isn't it? You're not loading it, right? One day out of blue, you come to the yoga mat and you suddenly decide to go for headstand. And therefore, you're going for some suicidal activities, I would say. Because suddenly you have decided, because for last 30 years, you have never done anything on the neck, no training, no loading, nothing. It is weak, isn't it? It is not even able to hold your head weight, and you're getting every now and then aches and pains. And then suddenly you decide that you will go for headstand. What do you think? What do you think from where that idea came into your mind? That without training it for the load of your lower body. So when we talk about lower body in comparison to the neck, so anything below it. So this is the neck, anything below it is lower body for the neck, isn't it? So this whole lower body, you're putting in on the weakest area of the spine. Why? What do you think? Ask yourself, isn't it? So maybe it will give you some opening, eye-opening to think that, yeah, why I was doing it. Or maybe when I get these questions in the class, what should I answer now? Okay, understand. I'm not saying you should not be doing headstand. You should be doing headstand. You know the actual reason why we say headstand as an advanced asana? It is not because that you are going to go upside down. No, not really. It is because we humans have started walking on 2 legs quite a million years back. And since then, we have forgot to load our necks. Our necks are only taking the load of the head in just moving it in the directions up, down, sideways, and sometimes we rotate it, modified rotations, isn't it? You must have gone through all this movement, flexion, extension, lateral flexions, and side rotations, isn't it? Right? So if you're not loading it ever, what do you think? That suddenly one day you will go on the mat and you will just change this world upside down? No, you will hurt yourself. So don't do it. Okay. The only reason we call it advanced asana. Why? So that you train it first. You train the neck muscles first, and then slowly and gradually you build the strength. And then you go upside down. And then also you're not directly loading the neck. You're keeping the weight on the hands, isn't it? Right? Similarly, same happens for your flexion related movements and extension related movements wherever you're loading the neck. So if you're not training the neck muscles first, slowly and gradually, and suddenly you're going for the fish pose, you're going for the shoulder stand, you're going for any loading posture wherever you're keeping the neck under the load too much into these directions, injury. God will save you then, right? But at the same time, if a bodybuilder comes, powerlifter comes, a sports person comes, who is training hard in the physical body and have good strength in the body, the muscles, in the neck muscles, in the shoulders, everywhere, have not done yoga ever in their life, have not done headstand ever in their life, for that person, I would not say that headstand is a advanced asana. No, not at all. That person can easily bear the load of that asana, right? Because the person is capable of doing that. All right. So asana is never advanced or beginner or intermediate category from the category itself. No, it is not. It is all about how much you're ready for it. Okay. Something which is a beginner asana for you can be advanced for someone else. Similarly, something which is very advanced for you can be very beginner level for someone else. All right. So you cannot categorize asanas from inversion category to standing category to seated category as an advanced, beginner, or intermediate. No. But how much time you have dedicated to the body to make it ready to do that kind of asana or kind of activity, I would say. Okay. It can be anything. It can be anything. All right. So beginner, intermediate, advanced, depending on your homework, how much you have done it off the mat, then on the mat. Okay, that's how you will perform. Cool, understood? Is it clear? So we need to understand that the anatomy of this. So what happens in the book, in the manual, you have great pictures, great illustrations. Watch them. That what happens whenever we are, so people who have cervical, what is cervical? Cervical is a region. Okay, cervical is not a disease. Okay, we call these, like, what is your name? What's your name? You have certain name, right? If someone will say, I've got Manoj, I have got Shushma. No, what is that, Shushma and Manoj? That's your name. Shushma have got certain problems. That's an issue. Manoj have got certain problems. That's an issue. But Manoj is not a problem. Neither Shushma is a problem, isn't it? Cervical is not a problem. That's a region. In that region, if there is some dysfunction, that's an issue. Okay. So this is a region here, right here. In this region, like I said, there are various nerve endings coming out, and we have very tiny space in between two. Okay, to accommodate. Can you see very tiny space in between two? So anytime whenever these two bones are coming closer and pinching that nerve, what it will do? Nerves are like your wires in the house, electricity wires. They will stimulate. They will give you currents everywhere. And that's why people with cervical type of pains or cervical type of radiating pains or maybe pinching pain, what happens with them? They get all irritations all the way down to them because the cervical area nerves are responsible, the upper one are responsible for the head region, and the lower ones are responsible for the hand and the chest region, the back region. So wherever you get, maybe most of the people get in the C6, C7, isn't it? So the C6, C7, it is responsible for this area, chest area, and then you get radiating pain everywhere, numbness. Why it is happening? Same reason. All right. So forget about yoga, forget about activity. People are getting cervical sitting at home, isn't it? Why? Your mentor must have told you a lot of things. It's a digital disaster, right? Cooking, isn't it? All day long like this, you're pinching and pinching your nerves, hanging your head forward all day long, same thing. So definitely you have to keep it back, right? Simple prevention. Apart from that, a lot of strengthening, a lot of other things, like how to, keep your shoulders and the scapula in relation to your cervical, so that while doing any asanas, you don't get any kind of impingement. That your mentor will take you through in the course. All right. Similarly, in the extension, again, behind, if you don't have enough room to move back, you will get the pain here as well or discomfort. Again, you will do the testing and assessment in the course. You will see that. For now, just remember one thing. that the tiny area, the tiny and weaker area is not meant to load too much in the beginning. People can do Nirlamb Sarvangasana also, Nirlamb headstand as well, Shirsasana also. But they do not do Nirlamb one just right on day one. They train for it, isn't it? If you see Buddhist monks, how they do? They do headstand without any hand support, isn't it? Are they doing wrong? No, they're not. They've trained for it since beginning. Have you seen their training? Since childhood, the moment the kids are 3 or 4, they're training so hard since beginning, isn't it? They're training so hard in the physical body. They're preparing their mind so strong, and then slowly and gradually they are moving ahead. And once they are ready, they're able to do all these things. You will be able to do the same thing, but are you training for it? How much training did you do? Ah, yeah, 2 sessions, isn't it? Ah, they are enough, right? And that also 30 minutes. Ah, that's good, wonderful. Congratulations, you are eligible to do headstands, but don't do it, okay? Don't do it like this, okay? Other things for the headstand, for shoulder stand, for your fish pose, in yoga, in relation to yoga, and in relation to other activities also, your trainer, your mentor will take you through from theoretical side that what all things we need to take care of. Let me just give you a little bit insight on the headstand part more when it comes. And also, you must be knowing that in the flexion and extension, not everyone is having the similar range of motions, right? And you know why? Because everyone have different biomechanics. Everyone have different biomechanics, different lengths. Someone have shorter necks, someone have longer necks, someone have higher vertebra, longer vertebra, shorter vertebra. Someone have maybe, you know, more tightness behind, someone have more tightness in the front, and that's why maybe you're unable to go back or unable to come forward. Because these things, even if tightness, I'm counting right now. Why? Because tightness will not go in one day. Right away, you will go on the mat and it will not go. It is a matter of period of time. So you have to dedicate certain time. You have to release those muscles. You have to come every day on the mat and go slowly with awareness. Keep on practicing so that you can keep on releasing the muscles. But then again, the principle of muscle tension and joint compression will still stay there, will still remain there. So you need to take care of that part as well, that you need to be aware of. Until the time you're getting the muscle tension, you're fine, you're okay. Keep controlling the muscle, keep walking easy with awareness, breathing, control, all fine. Once you get the joint compression, Namaskar is the only success mantra. Okay, leave the ego, keep it away, surrender yourself, accept what you have, move on. All right, got it? Aesthetics all the time is not good. Aesthetics is good, not all the time. Benefit you should be working on in yoga, outside yoga, in your life. Okay, got it? Rest of the things regarding your length, your proportion, and other things, your mentor will take you through that how the proportional differences of your arm and the neck can create a lot of trouble for you in your headstand. Okay. Until then, enjoy the course, and I will see you next for the thoracic area. Bye-bye.